Hello everyone. I'm Dr. Raina Shaikh from Nasik, India. I am a homeopath and I have been practicing homeopathy in Ashar Clinic for last 25 years. I will start my lecture by sharing the screen. Okay. So on this occasion of 90th birth anniversary of Dr. Ryke Geerd Hamer, we are celebrating the World GNM Day. So I start by paying my heartiest gratitude to Dr. Ryke Geerd Hamer, the father of GHK, and Dr. Hahnemann, the father of homeopathy, who have been showing light to me in my 25 years of practice. I also thank Team Ashar Clinic, who have been our support all throughout in making the PPTs and helping us with our lectures. So I read the disclaimer. The information given in this presentation is for educational purpose only. It is not intended to be a substitute for professional medical service. Participants shall consult their medical doctors for health reasons before using anything that is disclosed during this course of presentation. Students shall not use any of the different information given in this presentation while writing their examinations. So today we are going to learn a little about the conflicts which are related to lungs. So as we know, lungs and fear, according to the GNM, we are going to learn a little bit more about this. So metaphorically, the lungs we represent as the breath of life, freedom, space to exist. In German New Medicine, lungs are deeply connected to fear-based conflicts, particularly those which involve panic, territorial fears, or territorial threats, death fright, existential fear. So here we have this different types of fear conflicts which are given in the learning GNM. These are the death fright conflict, fear of suffocation conflict, scare fright conflict, territorial fear conflict, and the panic attack. Basically, there are two main types of conflicts which are related to the lung tissue, the alveoli, and these are the scare fright or the territorial fear. Which means there is sudden unexpected fright experienced as being startled or threatened, but not necessarily involving death fear or threatening life threatening thing. So in that you have the for example, in that you have diseases like asthma, bronchitis, or a dry cough. Whereas in death fright conflict, there is deep existential fear or panic of imminent death, often triggered by a life-threatening diagnosis, accident. So this death fright we will be learning in detail today. And especially the things which can lead to the conflict of death and the conditions which come under this is the lung cancer, bronchopneumonia, tuberculosis, lung abscesses, pleural effusion, and many others. So for example, here, alveoli, you have death fright conflict, the bronchial mucosa or the muscles. In the male, it is territorial fear conflict, and in female, you have the scare fright conflict. Then again, here is the trachea where you have not getting enough air. The goblet cells, you have fear of suffocation, a panic of not getting enough air. Pleura, there is attack conflict, attack against the chest. The diaphragm, which is not being able to breathe sufficiently or deeply enough. Development and function of the lung alveoli. So as we all know, the lungs are located on the either side of thorax, enclosed by ribcage and diaphragm on the lower side, separated by heart. So their primary role is to deliver oxygen to the other tissues and to remove carbon dioxide during exhalation. So air travels from the nose, the trachea, the bifurcation of trachea, then which splits into bronchi and bronchioles, and they end into the alveolar sacs. And these alveolar cells, which are also called as pneumocytes, regulate the gas exchange between the blood vessels, the capillaries, and the air inside the alveoli. So biologically, they are just as the intestinal cell. The regulate gas exchange and originate from the intestinal tissues. So like we have the food morsels, similarly these are the air morsels, and they are made up of intestinal type of epithelium which is derived from the endoderm and are controlled by the brain stem. So in this lecture, we are going to predominantly study about the death fright conflict. Death fright is linked to the lungs alveoli because in biological terms, the death panic is equated with not being able to breathe or not being able to inhale or exhale the air molecule. So what is a death fright conflict? It is experienced as any life-threatening situation. For example, course of an accident or during medical emergencies. The diagnosis shock, it is like when you go for examinations, when you do certain tests, and then the doctor come to a diagnosis and they tell you that you are suffering from so and so. So this comes as a shock because you have not expected those things, and then that will lead to this death fright conflict. Also, negative prognosis and test results, the self-diagnostic shot. These will be explained later in detail. So you have the death fright conflict can be experienced for one's life as well as for life of other loved ones, the family members, the friends, or your beloved friend or a pet. Even if they are under such fatal diseases or they have been diagnosed with certain fatal uh, diseases, then you can go into this death fright conflict. The control center on the brainstem relates to not being able to catch the morsel that is on the right side and eliminate the air morsel from the left side, uh, that is to inhale or exhale. Now we know from this that all this lung tissues are derived from endoderm and are controlled by the brainstem. Okay. Endoderm, which is the oldest biological layer. Hmm? So the organs controlled by brainstem are the oldest organ. So here we have the brainstem, and the oldest biological conflict in the oldest organ. Initially, it was just ingestion, the breathing, the procreation, and elimination. Okay. So what used to happen is whenever there is a conflict with any of the organs which are controlled by the brain stem, then during the conflict active phase, that organ goes into cell proliferation. The cells go into proliferation. And during the healing phase, then the additional cells are removed with the help of fungi and tubercular bacteria. Now, this tubercular bacteria is supposed to be the oldest bacteria. So, you have the oldest biological layer, the endoderm, controlled by brainstem, and which leads to cell proliferation. And then during the healing phase, it has been the additional cells are removed with the help of oldest bacteria. This is a paragraph which is taken from the learninggnm.com. I would just like to read it out to you. So the biological conflict linked to lung alveoli is death fright conflict because in biological term, the death panic is equated to not being able to breathe. The control center is in the right side of the brainstem relates to not being able to catch the air morsel, and from the left side is not being able to eliminate the air morsel. So in line with the evolutionary reasonings, morsel conflicts are the primary conflicts associated with brainstem control organs which are derived from endoderm. Now the death fright conflict can be experienced by life-threatening situations. For example, in course of an accident or during a medical emergency. By far, the most common death fright conflict, however, is brought on by diagnosis shock. As I had told you earlier, when a physician makes a statement that this person is suffering from a malignancy or a cancer. So, these statements are so aggressive, invasive, and they are so life threatening that the person who is listening to these statements, like he will not, this is a very aggressive disease, this is a metastasizing condition, it can spread to various other parts. So these can evoke an acute death panic in the person. The same holds true for a negative prognosis, like a result based on medical checkups, like the pap smear, the PSA tests, mammograms, colonoscopies, and other blood tests, which give you the diagnostic shocks. Even self-diagnosis can lead to these kinds of death frights. For example, when you detect a lump or say in the breast, when there is a blood in the stool or urine or from the vagina, then the person gets scared because uh, they think that it is a fatal thing to have these kinds of bloody discharges. And the most common thing which we now see in people are that when they see certain symptoms, they immediately try to Google it. And Google gives you the most extreme diagnosis, which may not be true with the patient. But then, because of that, the death fright can develop in the patient. So, this is a small video clip. This is from a movie which is called as Udi. Here he has come searching for his mom. This was during the some war. Huh? 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 You just have to see the expressions, how they change when he panics. Yes. आपकी एसिडिटी कैसी है? दवाई दे रहे हैं? ओके, बोलो। माँ का है? अंदर सो रही है? Stay up. Peacefuler, more peaceful. Yeah. Most peaceful. माँ इधर आई क्या? नहीं. She is going after him because he was his sister. They are worried about their mother. Perspiring, unable to think. Somebody gets their mother back and see how relaxed they feel now. But the conflict has already set because it was that portion where he was running and searching for his mother, and so many thoughts must be crowding in his mind at that time. So what happens? Because see, when there is a fear, the conflict has set in. So what happens during the conflict active phase? So according to the German New Medicine, during the conflict active phase of death fright shock, the lung responds by growing extra alveolar cells. That is what we studied earlier, that during the conflict active phase, there will be proliferation of cells. This is the body's natural attempt. So why there is more cell in during this conflict is because of the hyperventilation. He is falling short of oxygen. So what the body does is it increases its cells so that more oxygen can be absorbed at the time of that conflict and the patient can breathe more. So it because according to what the brain registers, it becomes a life-threatening situation, right? So if the fear or the conflict continues too long, these extra cells can form the flat nodules, which conventional medicine may call lung cancer. But in the German New Medicine, this is not seen as disease, but as a meaningful biological response to fear of death. So they were expecting in that earlier video, he was expecting something wrong must have happened with his mother. She must have come under something because she was not at home. So the conflict sets in and therefore there will be multiplication of the cells. So here is a diagrammatic representation of what happens is there is increased functioning of cell. So there is cell proliferation in the alveoli. The alveolar tissue gets inflamed. With more alveolar tissue, the air can be used better. So there will be better exchange of gases for better survival chances of the human being. If the activity or the conflict is prolonged, there will be flat growing lung nodule, which the conventional medicine terms as cancer. Okay, so when the conflict is there, we saw what happens. Then the conflict is resolved. The mother has come back. Now the conflict has resolved. So now what happens? Once the conflict is resolved, the healing phase begins. At this point, because there is multiplication of cells, so extra cells need to be removed. So the fungi or the mycobacteria like TB bacteria work to remove the extra cells that are no longer needed because now conflict is settled, right? So they don't need more oxygen, they don't need more cells. So the extra cells have to be removed. So there will be these bacteria. This leads to symptoms like coughing with phlegm, which may be milky, rusty, or even blood stained, often mistaken for pneumonia or infections like tuberculosis. There can be night sweats, which is very common, and if the infection is involving fungi in the healing phase, then it may present as lung candidiasis or so-called pulmonary fungal infection. So in healing phase, there will be PCL-A and PCL-B. So in A, there is edema. So how it occurs is if the conflict is not resolved, they feel like their life is still at stake. So what happens is the kidney collecting tubules start retaining water. It activates this kidney collecting tubules and start retaining water, and this collects in the lung during the healing phase, leading to lung edema, which further leads to breathing difficulty or respiratory failures. Then in the PCL-B, after the healing, air-filled cavities remain where the nodules were. If the healing keeps getting interrupted due to ongoing fear or repeated emotional relapses, like there is this fear, but sometimes a track remains, sometimes the conflict is only coming and going alternately. So then these cavities expand or fill with fibrous tissues, resulting in pulmonary fibrosis or lung scarring, which we medically call as sarcoidosis. In cases where antibiotics have already destroyed the required microbes, like the TB bacteria or the fungi, which come to eat up the extra cells, then the nodules cannot be broken. So instead, they become encapsulated and they remain in silent form in the lungs for years together. And then certain conditions crop up when people go for routine scans, and then these are mistakenly diagnosed as lung cancer, even though they are originated from some long resolved death fright. Already there has been death fright in the early phases and which is resolved. So you can be mistaken over there. Tubercular secretions, this is very important, excreted through the sputum is rich in protein. If the healing phase is long and intense, the protein deficiency is there in the person, which can be fatal. Death, however, is not caused by TB infection, but rather by protein depletion. So during the First World War, there was this epidemic of lung tuberculosis. It is all about that during this epidemic, many people during the healing phase, because there is too much of sputum coming out, and this sputum contains protein, which is rich in protein. So body is depleted. So the poor people, especially who could not take the protein rich food for which is needed during the healing phase, who were not into the camps and which were organized for the people who were suffering, so they were the people who succumbed to death because there was loss of protein which was becoming fatal. So only those who could afford adequate nutrition were able to survive. The poor had no chance. In the late 19th century, before the appearance of antibiotic, tuberculosis sanatoria provided those who were able to afford it with good nutrition, together with enforced rest, a perfect setup for assisting the healing. So that is why when a person is gone through that conflict, now he is in the healing phase, so they need good amount of protein-rich diet, they need rest, and these things have to be provided. If they are depleted of these, then the thing can become fatal. Also, that we usually come across this, that tuberculosis was eradicated when the antibiotics came into picture. But what happened was, coughing of blood previously was rightly diagnosed as lung tuberculosis. Today, the condition is called lung cancer. It is a renaming of the disease. That is the reason why number of lung cancer increased drastically with while tuberculosis disappeared. So when the and vaccines of tubercular vaccines came into picture, they thought that it has completely the tuberculosis was completely evacuated, but that was not the case. Tuberculosis, it was a renaming, like it is stated here in this slide. We all know about this chart. So here we have the normotonia. Okay, so when the conflict is set in, when there is a death fright conflict, there is dry cough, breathlessness, night sweat, fever, with prolonged sympatheticonia. And then when the conflict is resolved in the PCLA, there will be water retention leading to exudation, edema with pain, swelling, infection, and candidiasis or tuberculosis, depending upon what is the infection or which bacteria or fungus has come to help with the healing phase. And during the PCLB, there will be scarring with fibrosis and sarcoidosis. And if the conflict does not relapse again, then they will go into normotonia again. Let us study one case which is related to pulmonary tuberculosis. Now, as we know, pulmonary tuberculosis is a serious infection caused by bacteria, Mycobacterium tuberculosis, that involves the lung but may spread to other organs as well. So, biological conflict linked to lung tuberculosis is death fright conflict, and the lung alveoli are involved. So now this is a patient, 40 years, came with the presenting complaints of severe coughing since 7 to 8 days. Character of cough was whitish, expectoration, which is very sticky, spasmodic cough, throat irritation leading to coughing, aggravation while lying down in the evening and after talking, amelioration while sitting. He came with the presenting complaints of chest pain while coughing, throat pain during cough, headache during cough. Throat pain since 4 to 5 days, aggravated more on swallowing, nauseatic feeling after eating. Fever on and off since 4 to 5 days, fever with chills, extremities pain during fever. The effect of disease on that person was he becomes very irritable. Restlessness is there with cough mostly at night. Mostly cough increased after lying down. Cannot lie on bed because as it aggravates the complaint. Does not like disturbance at all. It's going on since many days. Still he is not getting better. There is anxiety about business. and gets irritated on family members, mostly at wife, if she asks for anything. The mental history of the patient. So this patient shared a very close emotional bond with his family. Due to his job issues, he chose to temporarily distance himself from his parents so that he could first settle himself and then call his parents over. However, one day he tried calling all his family members, and to his surprise, none of them answered. This triggered intense anxiety and worry, thoughts like, why is no one answering? And is everything okay at home? Which started troubling him. Later on, feeling helpless and increasingly fearful, he called a neighbor to check on his parents. So he was shocked to learn that both his parents were unwell and receiving IV fluids at home. This sudden and unexpected news struck him like lightning. The overwhelming fear of losing his parents triggered a deep death fright conflict. He also felt angry and disappointed that his parents didn't inform him first and instead took help from others. Okay, so this was the case. The analysis was the patient had a strong emotional bond with his family, and due to his job issues, he was staying at some other place. And then one day he was not able to contact them, which led to intense anxiety and sudden death fright conflict upon knowing that they were sick and on IV fluid. The unexpected shock, helplessness, and fear of losing them activated the alveolar lung program in GNM. So these were the rubrics taken: ailments from fright, anger with anxiety, health about relatives, fear contagion, cautious, helplessness feeling, fear happens, something will. And the medicine which we came to was arsenic al 30. We had given him 3 doses of it. This was his HRCT chest, which was done on 4th of April. And on 11th of April, we repeated the same after giving him the medicine, and the infection had come down. So now, after all the medication, after all the talk we had with patient, we had to counsel him because since he was staying away and he had taken that as that was like a shock to him, the news about his parents being on the IV. So we had to explain to him what the cause for his pulmonary tuberculosis was. And also we had to show him the bigger picture that the parents are well, now doing well, and the health will improve. We had to tell him that if he is well, then only he can be in a position to take care of his uh, parents. So after all this, he settled down, and then to completely recover, to completely get his appetite back, it took us another 7 to 8 days, but then he was good. So this is all about pulmonary tuberculosis. Thank you.